Hello and welcome to the special webinar hosted by the American Cleaning Institute, the continued role of hand hygiene and cleaning and disinfection in schools. I'm Brian Sansoni, ACI Senior Vice President of Communications, Outreach, and Membership. ACI provides science-based information on cleaning, hygiene, fabric care, and disinfecting practices for multiple audiences, which you can find year-round on our website, cleaninginstitute.org. We thank you for taking the time to join us today to listen to our conversation on some very important topics that are front and center for many of us. This webinar is designed to share best practices and key prevention strategies to keep students, staff, and the school communities at large safe and healthy. Before I introduce our expert speaker today, I want to mention just a couple of brief housekeeping items. You can submit questions by using the Ask Question feature. We'll get to as many questions as time allows. This webinar is being recorded. It will be available on demand and we'll notify all of today's registrants of that fact via email in the days ahead. We are fortunate to have with us today an expert from the Centers for Disease Control and Prevention. Dr. Vincent Hill is an expert in environmental microbiology and issues surrounding water, sanitation, and hygiene. Dr. Hill is chief of the Waterborne Disease Prevention Branch, which oversees CDC's hand hygiene activities in community settings, cleaning and disinfection in community settings, and waterborne disease activities. Dr. Hill joined CDC in 2003. He is a licensed professional engineer in civil engineering. He received his PhD in environmental science and engineering from the University of North Carolina at Chapel Hill School of Public Health and his MSc in environmental engineering from Johns Hopkins University. He is an author of more than 140 peer-reviewed journal articles, scientific reports, and patents focused on environmental microbiology and engineering. We greatly appreciate Dr. Hill for joining us today. Dr. Hill, we look forward to your presentation.
Thanks so much, Brian. Hello, and thanks for having me. This presentation will focus on promoting hand hygiene and cleaning and disinfection in schools, with a focus on COVID-19 prevention given the ongoing pandemic. Briefly, I would like to mention that there are no specific endorsements of any brand or product within my presentation. So let's start with how COVID-19 spreads. COVID-19 spreads mainly through close contact from person to person, principally between people who are physically near each other, like less than 6 feet apart in general. In most situations, the risk of COVID-19 infection from touching a surface is low. It is unlikely people will get COVID-19 by touching surfaces or objects. Transmission of the virus that causes COVID-19 is likely by direct contact and inhaling aerosols and droplets than by touching surfaces. This is similar to the transmission of other respiratory illnesses, particularly for transmission of cold and flu viruses. Respiratory viruses such as SARS-CoV-2, the virus that causes COVID-19, and is shown in the image on the right, influenza virus, and rhinovirus, which causes colds, have an outer layer called an envelope, as shown in the image on the right as well, that can be damaged relatively easy in the environment, especially outdoors where sunlight and heat can damage these viruses quickly. Respiratory etiquette, like sneezing into a tissue, and cleaning hands, hand washing, or using hand sanitizer, have a demonstrated effectiveness for preventing respiratory illnesses. The most reliable way to prevent infection from surfaces is to regularly wash hands or use hand sanitizer. In August 2021, CDC released updated guidance for COVID-19 prevention in K-12 schools. I want to briefly walk through the major prevention strategies. CDC recommends using multiple prevention strategies together in schools to prevent the spread of COVID-19. Vaccination among people 12 years and older is currently the leading public health prevention strategy to end the COVID-19 pandemic and can help schools safely return to in-person learning, as well as extracurricular activities and sports. Due to the circulating and highly contagious Delta variant, CDC recommends universal indoor masking by all students, ages 2 and older, staff, teachers, and visitors to K-12 schools, regardless of vaccination status. In addition to universal indoor masking, CDC recommends schools maintain at least 3 feet of physical distance between students within classrooms to reduce transmission risk. Along with these key prevention strategies, CDC recommends schools consider implementing additional layered prevention strategies. Layered prevention strategies are additional prevention strategies which can be used together consistently to help keep schools safe. These strategies include coughs and sneezes, screening testing, improving ventilation, frequent hand washing, covering coughs and sneezes, staying home when sick, and getting tested. Contact tracing in combination with isolation and quarantine, and cleaning and disinfection. Many schools serve children under the age of 12 who are not eligible for vaccination at this time. Therefore, CDC guidance emphasizes also using layered prevention strategies to protect students, teachers, staff, visitors, and other members of their households and to support in-person learning. So when we think about how to reduce the spread of COVID-19 in schools, CDC's top prevention messages are to get vaccinated, to wear a mask to protect yourself and others, and to maintain at least 3 feet of physical distance between students. Hand hygiene and cleaning and disinfection are 2 important layered prevention strategies and are the focus of this presentation. So there are a number of strategies that schools can take to promote hand hygiene, cleaning, and disinfection. I'll start first by discussing hand hygiene. First, I'd like to review the 5 steps for how to wash your hands. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community, from your home and workplace to childcare facilities and hospitals. You should follow these 5 easy steps each time. Wet your hands with clean running water, can be warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you need a timer, you can hum the happy birthday song from beginning to end twice. Rinse your hands well under clean running water, and then make sure to dry your hands thoroughly using a clean towel or air dry them. Schools should teach and reinforce for students and staff that they should wash their hands for at least 20 seconds with soap and water. If soap and water are not readily available, staff and children, those children who can safely use it, can use alcohol-based hand sanitizers that contain at least 60% alcohol. Encourage staff and students to cover coughs and sneezes with a tissue. Throw that used tissue away in the trash, and then wash their hands immediately with soap and water for at least 20 seconds. Schools can play an important role in promoting good health and hygiene practices by providing easy, frequent opportunity for students to wash hands. This could mean ensuring adequate time between classes or before lunch for students to wash their hands. Ideally, schools should ensure that soap, clean running water, drying materials such as paper towels or air hand dryers, tissues, and trash cans are available and easy to find, especially in classrooms and bathrooms. Consider providing alcohol-based hand sanitizer at locations where soap and water are not readily available, such as a dining hall that doesn't have a sink, and provide supervision to students who may not be able to use it on their own. Schools can also provide disposable masks for students who forget one or whose masks get dirty. Additionally, schools can use all sorts of media to reinforce preventive messages and promote healthy habits. They can post signs in visible locations, such as restrooms and school entrances, that promote everyday protective measures and describe how to stop the spread of germs. They can include healthy habits to prevent COVID-19 as part of their daily broadcast announcements, as well as share materials digitally, by email, and on websites or school social media accounts. CDC has free communications resources for COVID-19 that we will share on a resource page at the end of this presentation. So now let's talk a little bit about cleaning and disinfection practices. Two of the main ways that we can reduce the risk of surface transmission after a surface is already contaminated are cleaning with cleaning products containing soap or detergent, or using a disinfectant product registered with EPA's List N, which is EPA's list of products determined to be effective against SARS-CoV-2, the virus that causes COVID-19. Cleaning is the process of removing dirt and germs from surfaces. Cleaning does not necessarily kill germs, but by removing them. Cleaning lowers the number of germs and the risk of spreading infection. Disinfection is the process of killing germs on surfaces using chemicals. Disinfection does not necessarily clean dirty surfaces or remove germs, but by killing the germs on a surface after cleaning it, it can further lower the risk of spreading infection. Cleaning and disinfection can both reduce the risk of surface transmission. CDC's current cleaning and disinfection recommendations are based on the science around COVID-19 virus transmission. CDC conducted a scientific assessment and determined that the risk of transmission by touching contaminated surfaces or objects is low compared to direct contact, respiratory droplet transmission, or airborne transmission. CDC's scientific review found that cleaning can be effective for substantially reducing the number of germs on surfaces and can be expected to reduce the already low risk of virus transmission to help maintain a healthy facility. Because hands are how we usually touch surfaces, the most reliable way to prevent infection from surfaces is to regularly wash hands. Or if soap and water are not available, to use hand sanitizer that contains at least 60% alcohol. Routine, at least daily, cleaning and hand hygiene help reduce the already low risk of surface transmission. Our overall recommendations for schools come from what we learned in our scientific review. In schools, in most situations, cleaning surfaces using soap or detergent and not disinfecting is enough to reduce the already low risk of virus transmission from surfaces. Mask wearing and regularly practicing hand hygiene are also important for reducing surface transmission risks, as both these prevention strategies can also reduce the contamination of surfaces. In community settings like schools, in most situations, daily cleaning is usually enough to reduce any virus present on surfaces. However, if a person who is sick or positive for COVID-19 is known or suspected to have been in a space in the last 24 hours, clean and disinfect the space. Some other situations may prompt more frequent cleaning or may warrant choosing to disinfect. For example, in settings where there is high transmission of COVID-19 in the community, low mask usage, where hand hygiene is not performed frequently and consistently, and in places where people in the facility are at increased risk for severe illness from COVID-19. When cleaning or disinfecting, if needed, focus cleaning procedures on those high-touch surfaces like doorknobs and drinking fountains. Ensure that cleaning staff are trained and have the needed safety supplies. If choosing to disinfect, use EPA List N disinfectants and follow the product use guidance on the label. Disinfection products should not be used by children or near children. I also wanted to share some interesting findings from projects that CDC conducted exploring hand hygiene, cleaning, and disinfection activities in schools. The first set of information is from a needs assessment that we conducted with the National Parent-Teacher Association. In July and August 2020, we conducted a web-based survey with 2,614 adults affiliated with the National Parent-Teacher Association in order to better understand how to support hygiene-related activities in schools. The survey, which included both close-ended and open-ended questions, asked about respondents' experiences implementing hygiene-related activities in schools. Survey findings show the difficulties that many face in implementing hygiene-related activities. We found that the main barriers to carrying out hand hygiene activities included difficulties with monitoring students and enforcing hand hygiene, a lack of time or difficulties fitting hand hygiene into the schedule, a lack of funding, and a lack of training on how to teach hand hygiene. For cleaning and disinfection, we found that the main barriers were staff capacity, a lack of time, a lack of funding, and a perception that cleaning and disinfection were unnecessary. CDC also conducted a project to monitor and evaluate school mitigation strategies. This project, which launched in October 2020 and concluded in July 2021, used a mixed methods approach and incorporated numerous data sources, including cross-sectional surveys of teachers, parents, and students, sector-based surveys with school administrators and nurses, moderated web panel focus groups with school stakeholders, social media monitoring, and crowdsourced surveys targeting hot topics impacting schools. As part of the project, we asked questions about school hygiene activities like hand hygiene, respiratory etiquette, and cleaning and disinfection, which was referred to as enhanced cleaning in this project. Here are some of the facilitators of these behaviors that were reported by respondents. For hand hygiene, many schools provide access to hand washing stations or hand sanitizer dispensers at key points, including building entrances, dining areas, restrooms, classrooms, and administrative offices, which helps facilitate opportunities to perform hand hygiene during in-person learning. Respondents noted that print and verbal reminders, such as signs and PSAs, helped remind them to practice both hand hygiene and respiratory etiquette. Teachers have also designed creative lessons to facilitate proper hand hygiene among students. We also found that modeling of both hand hygiene and respiratory etiquette behaviors by peers and teachers helped to reinforce those behaviors. An additional reported facilitator of respiratory etiquette was that both formal education and verbal reminders help teach students to cough or sneeze into their elbows or to use a tissue. We learned of some barriers to hand hygiene, respiratory etiquette, and enhanced cleaning as well. A key barrier to hand hygiene was a lack of oversight that faculty and staff were able to provide to ensure students are correctly practicing hand hygiene at appropriate times. Teachers stated that the burden of supervising student hand hygiene interfered with their ability to effectively meet their teaching requirements. Further, the time allotted for transitioning between classes was too short for students to practice proper hand hygiene practice, and that in some instances, teachers reported that hand hygiene supplies were inappropriately located in areas that did not facilitate use. The need for faculty and staff involvement and oversight was also a barrier for respiratory etiquette. An additional barrier was a lack of adequate guidance on respiratory etiquette in schools. This guidance could touch upon ways that wearing a mask can impact typical respiratory etiquette practices and address questions such as whether one should take the mask off when sneezing or change the mask if it becomes wet. For enhanced cleaning, we found that many teachers are expected to clean and disinfect their own classrooms, and that time burden is a barrier for many to carry out cleaning and disinfection activities. Both teachers and students noted that more custodial staff to support increased cleaning needs would be helpful. Now I'd like to talk about next steps for addressing these study findings to promote hygiene in a safe and healthy school environment. We just learned a lot about experiences schools have had with implementing hand hygiene, cleaning, and disinfection activities. Some of these learnings, like encouraging creative lesson plans to teach hand hygiene and respiratory etiquette, making sure hand hygiene supplies are located at key points, using verbal and print reminders, and allowing for adequate time throughout the school schedule for hygiene activities. Well, these can be implemented at the school level. Some of these activities might need funding, but some of them are low cost. On the CDC side, we see opportunities to use these findings to help shape our communication strategies, our health messaging, and to further our research on mitigation practices in schools and early childhood education centers. For example, we are currently reviewing the scientific literature to see how we can update our guidance to reduce the burden on school staff in conducting cleaning and disinfection to maintain safe and healthy school environments. We're also working on developing a training aimed at many types of staff and administrators in K-12 schools and early childhood education centers to help them better integrate hand hygiene and cleaning and disinfection practices into daily activities. And lastly, we plan to share findings with different stakeholders, as we're doing now, to help identify ways to overcome barriers. And we hope to have more of a dialogue around this piece in the future. With that, I'll end by thanking you for your time and sharing this list of resources on COVID-19, which provides further information on the topics I outlined here. I want to send our best wishes for a happy and healthy start to the 2021-2022 school year. Thank you.
Thank you, Dr. Hill, for those important insights and information sharing. Definitely a benefit to our audience today. So let's get into a few questions based on some of the topics that you've covered. Indeed, we've read a lot in the news about the newer variants of the coronavirus. So do the new variants last on surfaces longer? And does cleaning and disinfection work on the new variants based on what we know thus far?
Yeah, that's a great question. So there's no evidence that COVID-19 variants survive longer on surfaces. Because variants and early COVID-19 strains have very similar physical characteristics, there are not likely to be meaningful differences in the length of time they will survive on surfaces. Disinfectants from the EPA List N kill all strains of COVID-19.
So another question. So if there's a city or county or state governing body that recommends disinfection for their facility, people hear CDC guidance. Any thoughts on that?
Yeah, I mean, real short and simple. CDC guidance does not replace state or local public health guidance or their regulations.
Yeah. All right. Another question. In school settings, certainly there are lots of touch screens and computers and keypads. Again, as students are going back to campus, to the school buildings, any perspective advice on cleaning, electronics and touch screens and keypads?
Yeah, great question, because you want to keep those clean, right? So, for electronics such as phones, tablets, touchscreens, keyboards, and remote controls, for those things that you can, put a wipeable cover on them, that makes a lot of sense because it's going to make the cleaning easier if you're able to do that with the device. In all cases, follow the manufacturer's instructions and recommendations for cleaning the electronic device. And if it's needed to use a disinfectant, use one, of course, from the EPA List N, but make sure it's compatible with your electronic device.
Is there a list of cleaners that work well, similar to EPA's List N for disinfectants? And how do folks choose the right cleaning product?
Yeah, so there's not a similar list for cleaners. So you should use a commercially available cleaning product that's appropriate for your setting and for the surface to be cleaned. And again, always follow the manufacturer guidance on that. And so if you're doing all that, they should all be equally effective for cleaning the surface, removing dirt and the germs that come along with it. But there's not a similar list for cleaners like there are for disinfectants.
So here's a question you may hear of often. It's about drying one's hands. Should I use a paper towel, an air dryer? Is there any perspective on that you can share?
Yeah, so there's currently not enough scientific evidence to determine if using a clean towel or an air hand dryer to dry your hands is more effective at reducing germs on your hands. So there's just not enough scientific data on that right now. So we consider both to be effective ways for drying your hands. The main thing for everyone to keep in mind is that germs spread more easily when hands are wet. So after you wash your hands, make sure to dry your hands completely, whatever method you use.
Another question now about cleaning specific surfaces in schools. Specifically, the question is, how do you recommend cleaning public playground equipment or shared toys for young children, say at a community facility?
Yeah, so CDC recommends that schools and community facilities for children use, and layer multiple prevention strategies to reduce transmission of SARS-CoV-2. So including good hand hygiene and mask wearing. So that's the first thing. But the additional strategy, especially when we're thinking about these playground equipment, is cleaning and disinfecting to maintain healthy facilities. So these high-touch surfaces on playground equipment, like the grab bars and railings, they should be cleaned regularly. For example, using soap and water or a household surface cleaner. Cleaning of wooden plate structures is not recommended. For facilities serving young children and others who may not consistently or properly wear masks, wash their hands, or cover coughs and sneezes, the relative risk of surface transmission is still low compared with the risk of respiratory and direct contact transmission. So, but still, it's prudent to limit the use of shared objects in those cases and consider performing more frequent cleaning to the extent that's practical.
We are talking with Dr. Vincent Hill from the Centers for Disease Control and Prevention. So another question, how does CDC's guidance relate to controlling infectious diseases with known surface transmission routes like norovirus?
Yeah, that's great, because it's real important to be clear about what's being recommended with COVID in mind, and what's recommendations that have been there for a long time about other infectious diseases. So CDC's cleaning and disinfection guidance applies to COVID-specific situations and does not supersede cleaning or disinfection guidance for other pathogens or regulated settings. Cleaning and disinfection are important actions that schools can take to prevent the spread of other infectious diseases, and schools should follow appropriate guidelines for those.
So let's revisit a topic that you alluded to in your presentation, because we are reading about some occurrences in some school districts across the country of COVID cases being discovered. So what should people do, schools do to clean and disinfect surfaces if indeed someone suspected or confirmed to have COVID-19 has been in an indoor space?
Okay, great. Yeah, let's definitely spend some time and make this clear on the guidance on this. So cleaning and disinfection are recommended in indoor community settings where there has been a suspected or confirmed case of COVID-19 within the last 24 hours. And again, when cleaning and disinfecting during the first 24 hours, the risk can be reduced by increasing ventilation and waiting as long as possible before entering the space. For anybody doing this kind of work, we want to make sure they're safe doing it. So they want them to get in there and clean and disinfect, but also protect themselves. So increase the ventilation, wait as long as you can before going in there, at least several hours. So, and also make sure they use personal protective equipment, including any protection that might be needed for the cleaning and disinfection products that are being used, such as gloves and goggles. Now, that's within 24 hours. If more than 24 hours have passed since the person who is suspected or confirmed to have COVID-19 has been in the space, cleaning with soap or detergent is enough in most situations. Disinfection may be appropriate in certain situations that may increase risk from touching surfaces, including high transmission of COVID-19 in the community, low number of people wearing masks, infrequent hand hygiene, or the presence of people at increased risk for severe illness from COVID-19. So those are kind of site-specific and community-specific considerations, but in general, if it's been more than 24 hours, cleaning should be sufficient with soap and water, kind of or detergent product.
So let's spend a few moments talking about some of the research that CDC just concluded. Were you surprised by any of the findings from the PTA needs assessment and the mitigation strategies review you conducted? There's a lot of great information there.
There really is a wealth of information there. We're really happy that we were able to work with partners to get that survey completed. So from the needs assessment survey, many of the barriers identified touched on recurring issues we've heard about regarding lack of staff capacity, lack of time, and lack of funding. One identified barrier to hand hygiene that I thought was interesting was interesting, but maybe not surprising, was this idea of there being a lack of training on how to teach hand hygiene. So which I see as kind of acknowledging the importance of training and an interest in training and education materials on how to improve hand hygiene practices among students. So this is an area that CDC, ACI, and other partners are collaborating to address. Maybe one surprising result, I thought, was related to cleaning and disinfection barriers, where some respondents reported a perception that cleaning and disinfection was unnecessary. So interesting, because that result indicates a need to develop additional training and education materials on the importance of cleaning and disinfection for maintaining healthy school facilities.
So given these results, how important is it to teach about hand hygiene in school settings?
Yeah, thanks. So the data underscored a key theme: improved and increased hand hygiene education in schools is needed. Several challenges that staff indicated, such as difficulty monitoring students and enforcing hand hygiene, and a lack of training on how to teach hand hygiene, highlight the need to help students understand how important clean hands are to their health, and the benefits of empowering them to make informed choices regarding hand hygiene.
So among those of us who are viewing the webinar today, what advice might you have, Dr. Hill, about what our school communities can do to strengthen the commitment to good hygiene and cleaning practices?
Yeah, so I think a good place to start is kind of like we're doing now, is about simply talking about it and learning about things, about the importance of hand hygiene and cleaning practices. For people here listening in, the importance of doing this within your personal networks and your professional networks. Share resources that reinforce cleaning hands and maintaining clean school environments are important, like posters, stickers, and other signage. So you can post them, you can share them, etc. It's about having that conversation and providing that information to each other, those resources. People can also post, if you do social media, you can post about cleaning your hands or things you're doing in your school on social media. Basically getting others excited about washing their hands and keeping spaces clean.
Well, there's an awful lot of information packed into today's webinar. So we want to again express our appreciation to you, Dr. Hill, for sharing so much useful and expert insights with our audience today. As a reminder, this broadcast will be made available for on-demand viewing. We'll share those details with you via email in the days ahead, and we urge you, the link that you'll receive, to share that within your school communities, your local parent-teacher organizations. This information is really about enhancing school health and reducing school absenteeism. We also invite you to visit the American Cleaning Institute's website for year-round information on cleaning, disinfection, hand hygiene, and fabric care at cleaninginstitute.org. Today's webinar is part of ACI and CDC's joint initiative, Healthy Schools, Healthy People. That's designed to promote hand hygiene and cleaning practices as a means to prevent the spread of infectious disease in schools and to reduce illness-related absenteeism. This website offers resources for teachers, educators, school nurses who are at the front lines of school health, administrators, parents, and students. The site also features interactive games for students. There's a quarterly newsletter, educational webinars like this one, and targeted social media messaging. For more information, please visit healthyschools.healthypeople.org and sign up for our newsletter. This is meant to be a year-round resource for school communities at large. I'm Brian Sansoni on behalf of ACI and our member companies. Thank you all for joining us today, and please stay safe and stay healthy.